This is a time when we are actually in the right place at the right time with tremendous opportunity to fix our healthcare. Everyone knows that our healthcare system is really in trouble. We are considered the sickest generation ever. And it's all based on this concept that our existing healthcare system is one size fits all, primarily designed around managing symptoms, not fixing people. That is why we are so excited about this opportunity to have smart investors involved, because we're really at the cusp of this revolution to scale personalization of health, and would love to have you participate in that with us. Our personalized health platform is called IQYOU. It's really cloud-based. We simply send you a link, go to a website, and then we will give you results and information right away on lifestyle and foods and nutrients. We have labs that we have the ability to enter into our system. And then there's also genomics that look at the underlying biochemistry, whether it's digestive, endocrine, autoimmune, neurological, etc. We look at the most important SNPs so we can help get to your why and the root cause. But you can now understand for the first time your unique blueprint, your unique code, and everyone's got a one-of-a-kind blueprint and code for their health. In 2012, right at New Year's Eve, my wife yells, called 911. Our 8-year-old daughter was having a seizure. It turns out that it was a grand mal seizure. And eventually, through the traditional Goliath system, we get our diagnosis, childhood benign epilepsy. As almost any parent would do, I said, let me do a search. There's got to be a why behind this. She had an issue with sulfur. So sulfur's in things like eggs, broccoli, cauliflower, garlic. So for her, sulfur is like a toxin, and something only if you're doing deep personalization can you really understand and get to that. And it turns out that she had poor ability to get toxins out of her system. And to confirm that, there's also labs that you can do to see if you've actually got those toxins in your system, which my daughter did. So incredibly, once we took a couple simple actions and reduced and really eliminated the eggs, which was a big problem for her, my daughter Tess is doing great now. She's competing in acrobatics because of everything that we've learned over the last couple years and the acceleration of the science and our ability to look at genes and labs and so forth. 4 years ago, I had the good pleasure of being introduced to Dr. Joe Pizzorno and his team of researchers, scientists, and technology folks who were working on AI, artificial intelligence, to really scale personalization. So what's so impressive about Dr. Pizzorno is that he's founder of Bastyr University, considered the Harvard of clinical nutrition, where top nutritionists, functional medicine docs, naturopathic docs come and learn and study. And he's considered the father of evidence-based nutrition. He is a phenomenal partner and a great thought leader that is driving the logic and the science behind our partnership and our technology.
I've been involved in medicine now for almost half a century. So I've been studying this for a long period of time. And through both seeing patients directly, as well as taking care of people through corporate wellness programs, I've helped tens of thousands of people. And over that 50 years, I've had an opportunity to look at what makes people sick and how do they become healthy. So let's be honest with ourselves. We say we have a healthcare system. We don't. We have a disease treatment system. It does not deal with the reason why people are sick. People are sick not because of a deficiency in a drug. They're sick because of a deficiency in a nutrient that they need, a genetic susceptibility, or because they're being poisoned with some kind of toxin. Only 20% of disease is due to genetics, 80% is due to lifestyle, diet, environmental toxic exposure. Our health is in our hands. It's our choices that determine if we're healthy or if we have a severe burden of disease.
All the data in our system is driven by clinical studies. We have tens of thousands of peer-reviewed medical research that supports all the connections in our system. If someone uses our system and they see that they are more likely to have a high risk of diabetes because of arsenic, right immediately accessible to them are the peer-reviewed medical research studies showing that connection.
Our IQYOU platform is in beta now. We have users in. We have people going through and putting genes in and putting lab work in and answering all these questions on their lifestyle. And we're working with our team to get to the point where we can really give you the couple big needle movers that are going to make all the difference to you. So the potential is there. In the next 6 to 12 months, we're going to continue to go forward with this with Dr. Joe Pizzorno, but most importantly, make it really easy for customers and clients and patients to understand the importance to them. So please, 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 click the link below. Join our movement. Share this with your friends and family, and let's make a huge difference in changing the paradigm and moving to a personalized health model.